So often, I believe that patients, the first sign is bleeding gums. And so this is kind of talking about the possibility of overlooking bleeding gums. So I think in many respects, the patient has so much dental anxiety or fear of the fact that they may have gum disease. They might see their gums bleeding or some signs of bleeding when they spit out after they brush their teeth, or maybe when they floss, they see blood on the floss, and many times they can be in complete denial. Or realize, oh, I think I have a problem, but I really don't want to deal with it. So time will go by when they really realize all the while that there is a problem. And of course, the longer time goes, the more the problem gets worse. Well, when we talk about periodontal surgery, what's beneath that, of course, is we're trying to save teeth. And why are we trying to save teeth? One, because patients obviously want their teeth saved, but secondly, in terms of speech and appearance and the ability to chew, and of course feel comfortable, people are usually happier with their own teeth as opposed to prosthetic replacement teeth, even including dental implants. So the goal is to save teeth. So many times when gum disease is advanced, we'll do all the conservative treatments we can to stabilize the disease process. But when we need to take a step further to kind of gain added success in terms of stabilizing and controlling their gum disease, we may have to use a surgical option. So when we have to turn to a surgical option, we try to do the surgery as conservatively as possible. And then in terms of advancements, there are different materials that are available now to really help us gain better results in terms of bone grafting and in terms of gum tissue healing, and generally in a quicker time and in a more or less painful time. We really have to do a good job of using video technology and our intraoral cameras to really show them the full extent of what's going on. We also, of course, use x-rays, and then we can show them on the x-ray what normal level of the bone support should be and where their particular bone level is. And I think most people can grasp the fact that as they're losing more and more supporting bone, the teeth are becoming more and more loose, and generally without treatment it's a matter of time until they might lose those teeth. So at that point, people are pretty motivated to kind of do whatever they need to do to stop this process if it's possible to do. So we lay that out for them and talk through the details and do this at their pace in a comfortable way. The timing of gum disease and as to whether we treat it early versus advanced is a night and day difference in terms of success many times, most of the time. So if we can treat a problem early, it's just easier for the patient in every way. It's less pain, less time, less cost, and higher degree of success. You know, I'm thinking of a patient that I started with about 35 years ago. And she, at that point, actually she's 100 now. She just turned 100 this year. But she had numerous rounds of periodontal surgery and or extractions and a few dental implants at that point when I met her 35 years ago. And I began the process of doing another reconstruction. And she's a phenomenal patient, just super supportive, easygoing, and follows everything we suggested. Anyway, the success is she has everything we did 35 years ago has remained stable, including dental implants. And it is just so thrilling when she comes through, even now, to have her teeth cleaned, that she has no sign of gum disease, complete periodontal health. She's thrilled about it, and that's been the case for about the last 20 years. So that's a great example where this treatment does work, particularly when the patient does follow up with the oral hygiene suggestions that we try to make.